Okay, so not only are we having some obvious dysfunction with the lumbar spine, what we're also seeing is a lack of hip extension and likely a lack of hip internal rotation. And you can demonstrate this. When people have a jammed up vertebrae in their spine, it can happen on its own, but very likely there's something else that's in play. One of the things is that there's the lumbo-pelvic mechanics. You have hip, your sacroiliac joint, and your lumbar spine. They're very intertwined because they're in a very small space together. And you can demonstrate this on a patient. So I'm going to have you lift your leg up for me. Just relax there. Give that to me. Perfect. So what's happening is when people walk, they need about 35, 40 degrees of hip flexion. Okay. And ideally, for the hip to do its job, it should have 15 degrees of extension. So he should be able to come back all the way to 15 degrees. But I can't get him there. This is 0. He is straight up and down, and I'm already hitting resistance. Can you feel how that hip kind of stops?
Yeah.
Okay. So, but he's leaving that 15 to 20 degrees on the table. What's going to happen is the sacroiliac joint is going to over-rotate. That was that leg length discrepancy we've seen. Because if the hip is over-rotating, it's going to drag it up along, and it's going to take that leg along with it. But since that sacroiliac joint can't give a lot, the next logical place he's going to get it is at the lumbar spine. So if I really try to take him into that extension, it's subtle and you may not be able to see it, but what I'm starting to see is this. You're starting to see that back starting to increase in terms of its extension, and that's going to jam up the lumbar spine. So he's extending, but not like he's leaning backwards. He's extending like he's sticking his butt out and leaning backwards here, and this creates extension from the bottom up versus the top down. So James, I'm going to have you go ahead and roll onto your stomach for me, or excuse me, your back, I'm sorry. And what I'm also expecting to see on this leg is a lack of internal rotation. So if I bring him here, this is 0. Ideally, he should have 35 degrees, but I'm hitting resistance. I'm not even at 15 degrees, and I'm rounding up on it. So that's that 15 degrees of internal rotation that he can't get into to then fully extend. Because when you extend the hip, you have to internally rotate. So he's pretty jammed up right there. Drop that for me. And then just to compare, here, I can swing them all the way out to that 35 degrees without a problem. So what happens is that lack of hip mobility is what's causing some of this back pain. So what I do, go ahead and bend your right knee for me, is we do a hip internal rotation mobilization. We loop a belt in. Buckle up for safety. So you bring the patient into that internal rotation to where they can go. Drop that. And you do some quick mobilizations. So I'm just kind of distracting that hip and just bringing him into that internal rotation that he can't get into. Now, if he can't get into that internal rotation even after the mobilizations, then you might be looking at a hip dysplasia or a hip impingement. The patient's on the younger side, so he may not necessarily know it, and sometimes it can be missed. And then now, hip internal rotation. Get him out to that 35. Feels different, doesn't it?
Way different.
So it can actually swing him all the way out into that 35 degrees that he needs. Now he can extend. So it's more than just those hip flexors.
Okay, here we are seeing what normal walking would look like. This right hip can fully extend to 15 degrees, and you'll notice just above the pelvis has kind of a flat, almost linear rotation from side to side, and that's what that would look like from the side. And this is what normal walking would look like from the back. What you can see is, again, a kind of a flat horizontal rotation of the pelvis, because that hip is able to fully extend and get its full rotation. And this is what happens when there's a lack of hip mobility. You'll notice from the first video, it's not as flat and straight horizontal, but there is almost an upward component up and to the left when that hip can't fully extend, and that's because that lumbar spine is extending from the bottom up. And from the back, you can definitely see how that lack of hip mobility is increasing the amount of stress on the right side of the lumbar spine. Because that hip can't fully internally rotate and extend, that extension has to come from somewhere. So subtly, that extension at the lumbar spine is what's causing the irritation of the disc and the joints, resulting in not only pain, but weakness in the right gluteal muscles.